In this video, we are going to take a look at how we can avoid blood errors. It is important to cover this topic as preventable blood errors account for a whopping 85.5% of transfusion errors in the UK. This is errors such as labelling errors and transfusion of incorrect blood components. Now let's take a look at how we can make these errors a never event. The key stage in the blood sampling process is definitely the bedside checks. Labels should always be printed first and then taken to the bedside or handwritten where applicable. Anyone who has ever worked in an emergency department knows that distractions are plentiful, so walking away from the patient and labelling at the nurse's station has the potential to cause an error. Research shows that places that have a high level of sampling errors fail to follow this simple procedure. So always label at the bedside and ensure you have verified the patient's details. But what about in an emergency, I hear you ask? Well, in an emergency, we have an even bigger responsibility to ensure the patient's safety, because there is an even higher chance of things going wrong. A, because we are rushed, and B, because we are working alongside other team members. So the key here is that whoever takes the blood labels the blood. If the patient details are not immediately available, then we can still perform a bedside check once the labels are available. Never label for a team member and never check the patient's details at the nurse's station or a computer. Now then, meet Andrew. Andrew is a surgical doctor who is very concerned about his patient who is needing emergency abdominal surgery. He asks you for your assistance in preparing the patient for theatre. He asks you to insert a cannula and take bloods with 2 group and save samples to cross-match. A reasonable request. The risk here is that the patient could be accidentally transfused with the wrong unit of blood. Why? Well, if the nurse taking the sample accidentally labels the bottles with the wrong details, there are 2 group and save bottles with the same blood, so the labs will assume they have the correct blood. Or, to put this more simply, the purpose of taking 2 cross-matching bottles is to safeguard against errors. If the first nurse makes an error, the second nurse will highlight this in the second sample. To summarise how to avoid blood errors, always check patient identity and label the sample at the bedside. Never label at the nurse's station or the computer. Always take group and save bottles individually and never take 2 samples together. Do these simple things and you will never go wrong.